webinar this morning. Okay, so thanks everybody for joining us this morning. I'm really delighted to have so many people join us for the launch of the Sheds for Life Impact Report. I will start by giving you some background information to the Men's Sheds Association and the Sheds for Life programme. The Irish Men's Sheds Association was founded in 2011. That means we're 10 years old this year. There are currently 360 sheds in the Republic of Ireland, with a total of 450 sheds on the island of Ireland. Our role as a national organisation is to represent and support the sheds and their members. The Sheds for Life project, which was developed by the Irish Men's Sheds Association, is unique among shed organisations internationally. It is a community-based 10-week health programme which takes place within the shed, focusing on physical activity, healthy eating, mental health and other health and well-being components. This was ran on a pilot basis in counties Kildare, Waterford, Louth and Limerick. Then a year later, research and an evaluation of the programme was carried out on behalf of the Irish Men's Sheds Association by Waterford Institute of Technology and very kindly funded by the Irish Research Council. The research results show significant increase in engagement with what sometimes can be seen as a hard to reach group of men, increasing their physical activity levels, mental health well-being, an understanding of their own health, and an increased sense of belonging, improved healthy eating, and improved online skills. They also showed far greater understanding and awareness of cancer, for example, diabetes, heart and stroke issues, and suicide prevention. We are very encouraged that this target intervention produced such long-term positive change, and also with the research has proved that this is a very cost-effective model. I will now take you through an overview of today's events, which will take place and will last for about 45 minutes or so. Unfortunately, Minister Donnelly cannot be with us this morning live, that is, but he has very kindly provided us with a pre-recorded video. This will be followed by some digital storytelling about the Sheds for Life programme by men who participated in it and to share with us their own personal lived experience of the programme. We will then have a presentation on the findings of the impact report by lead researcher Aisling McGrath from the Waterford Institute of Technology. Aisling will be followed by two speakers, Laura McGaughey, Executive Director of Sláinte Care, and Helen Dealey, the Interim Assistant National Director of Health and Wellbeing with the HSE. This will then be followed by a discussion panel consisting of Dr. Noel Richardson, National Centre for Men's Health in Carlow IT, again Aisling McGrath, the lead researcher from Waterford Institute of Technology, Fergal Fox is the General Manager of General Manager and Head of Stakeholder Engagement with the HSE, and Muriel Farrell from the lead programme with Sláinte Care. Also at this point, if the audience want to ask any questions, you can submit them through the questions and answers button at the bottom of your screen. I suppose before we continue with the video from Minister Donnelly, I would like to take the opportunity, I suppose, to remind people this morning that today also marks the start of International Men's Health Week, which gives us the opportunity each year to raise awareness of men's health and encourage men to take a proactive role in maintaining and improving their own health. I would like to take the opportunity to encourage all men of all ages to get involved this week in at least one of the many programs that are taking place. We will now proceed with the video from Minister Donnelly.
Good morning, everyone. I'm really pleased to have this opportunity to speak to you on the occasion of the launch of the Sheds for Life Impact Report. It's very fitting that today also marks the beginning of Men's Health Week, when we come together to heighten awareness of men's health and what we can do to improve it. The Irish Men's Shed movement has made a very significant contribution in this respect since the first Irish Shed was formed in Tipperary in 2009. Since then, we've seen over 400 sheds established. In fact, my understanding is that Ireland has the most men's shed per head of population anywhere in the world, which is a remarkable achievement. While most sheds engage in activities such as woodwork, gardening, community work, we all know that at its heart, the sheds are really about is friendship and the chat over a cup of tea. We know that for some men, for many men, we have difficulty talking to others, especially to other men, about our feelings, experiences, and struggles. Men's Sheds provides a safe, inclusive, and supportive space, which offers a social support and a sense of purpose and belonging, which is essential for well-being. The report we're launching today demonstrates very clearly the positive impact which the sheds can have for members. I'm particularly pleased by the findings in relation to an increase in physical activity amongst participants. Improving physical activity levels right across the population is a really important objective of our Healthy Ireland strategy, as demonstrated by the publication of the National Physical Activity Plan in 2016. I'm also really happy to note the increases in mental well-being, with participants showing sustained improvement in understanding and having a conversation about mental health and feeling equipped with supports to maintain mental health. The report provides important information here on how the loss of sheds by members during the pandemic has impacted them in terms of feeling isolated. This isolation was something we took steps to address during the Keep Well campaign, through the local community call helpline and befriending service, and guiding people to resources such as yourmentalhealth.ie, the website, and other online supports. Today's report also makes the point that an emphasis on men's health promotion programs in the wake of COVID-19 is going to be needed. It's an important point and is fully in keeping with the development of policy in recent years in relation to men's health. As you'll also be aware, Ireland was the first country in the world to publish a national men's health policy in 2009. We've been at the forefront internationally in advancing men's health at a research, policy and advocacy level. The Irish Men's Sheds Association has played a vital role in this journey, and the launch of today's report marks another milestone on that journey. It only remains for me to congratulate your CEO, Enda Egan, Ashleen McGrath, who produced today's report, and all of your stakeholders and funders on the success of the Sheds for Life programme. I know today's report makes a number of recommendations based on the research carried out for the report, and I want to wish you every success in implementing these and building further on the fantastic work already carried out. Thanks a million and best of luck.
Okay, thanks very much to Minister Donnelly for that video that he sent over. I'm sure the Minister won't mind me disagreeing with him on one point, and that is, I'm afraid his apportioning of credibility to myself for anything to do with this programme is widely inaccurate. This programme has been developed over the last 3 or 4 years. I think our previous CEO, Barry Sheridan, needs to take a lot of credit for it, as does our previous manager of our Health and Wellbeing Department, Edel Burns. As most people would know, I'm only about 3 months in this position, so unfortunately I can't take any credibility for it. I do think a couple of points that he made are quite important. The first one being about the cup of tea in the shed. I think the most important tool in any of the sheds is the kettle, and I think many sheds in actual fact have a requirement for maybe 2 or 3 kettles at any one time. But it is very accurate to say, I think, that this programme does fit very much with policy development over the last couple of years in this country, and we probably have been ahead of many countries in relation to policy development for men's health. And I think he's also right in saying that programmes such as this are going to be really in high demand post-COVID. At this point, I'm just going to pass over to another video, which is our digital story in relation to the Sheds for Life programme. And it's been filmed predominantly in sheds in County Kildare and in County Waterford. And I think it gives a really good indication and insight into the lived experience that men has had on this programme.
The Irish Men's Shed Association started an initiative called Sheds for Life back in 2017. It's a dedicated men's health and wellbeing initiative that covers aspects of physical, mental and social wellbeing. We collaboratively work with the men to find out what their needs are, what their interests are and what way they find is the best way to approach men's health in the men's shed setting. We piloted various different components of programmes with leading healthcare organisations in Ireland, and now we've collaboratively put them all together in this Informal 10-week programme.
The Shed for Life. I find this great because it helps focuses my mind, and it's great to get out. I prefer to walk with people rather than my own. Same bunch of lads nearly every week, and as I say, the crack is 90. Again, that's what it's all about, you know. The cooking classes are brilliant as well. The lady who comes here, she's brilliant. She's very interesting. She makes the whole cooking thing quite simple, quite easy. To have these facilities and people come in and talk to us and help us along with this kind of thing. Again, it's another wonderful thing. It's mighty, you know.
Sheds for Life programme I think is brilliant. Coming from a paramedic background, I believe in what they're doing. The food programme and the walking is very good. The computer course is excellent. I would be very technically illiterate, but I've come on in the few weeks that we're doing it, learned lots. The whole thing of the shed is fantastic. In just the year that we're here, you can actually see the benefits, both mentally and physically. Guys are different, there's spring in their step going, and anyone that in a bit of maybe social isolation, just fantastic.
It's a weekly thing. On a Tuesday we go and we train, do a little bit of soft training, you know, for our age we don't do anything too hard. But yeah, it's great, and it's great for the camaraderie that brings us closer again. You know, you limber up and then you do a little bit of like light weights, but look, everything works. And again, you're together with a bunch of lads, and it's great for. It's a tonic. Through the men's shed, it's just crack, and it just lifts you up out of you know, if you're feeling down, you go up there for the half an hour, and the next thing you're in top form. If men can talk about their problems, their mental health, just to unload what's on your head. And that's the men's shed. You can go in and you can unload, because the men will listen to you, and I think that's just fantastic.
I think it's brilliant. Topped by today, I have to say. The way Jenny of the Diabetes Ireland conducted it was amazing, that she sat among us. It wasn't a she and us type scenario. We were all there as a group. She listened to everybody and she explained everything in a phenomenal fashion. We share everything. Let it be good, bad or indifferent. It's shared, and as you probably well know, life teaches you that a problem shared is a problem halved. Everybody's equally important, shall we say, here, and we all treat one another with respect. So yeah, I became a member, and ever since that, on a daily basis, you feel better and better and better about myself and participation. And rather than being a single individual sitting up at home feeling sorry for myself, I'm now part of something that's wonderful.
What we're hoping to learn from Sheds for Life is really what works best for the men in the sheds. All of these men are here ready and willing to actually take part in the programme, and again, they designed the programme so it's what they want it to be, and when they take ownership they realise, yes, we can actually engage with health.
The impact we want to see through Sheds for Life is giving the men an opportunity to engage in health on their terms and in that informal setting of the shed. Outreach and finding a way to deliver a programme on the men's own terms and where they feel most comfortable is really, really key to Sheds for Life. We're proving that men can do health, it's just the approach that you take is so important.
I think everyone will agree that that was a very good video and very positive, and I'd just like to take the opportunity, I suppose, to thank the men who were on it, Eddie Bennett, Jerry Boland, Jim Eyre and Joe Carroll. I think, as has been said a couple of times throughout the video, the key thing that really makes it work is that it is delivered on men's own terms, and they have a real input into the content and how it's actually delivered. And the very fact that it's delivered in the shed seems to have a huge positive impact on the actual level and the prolonged impact of the actual modules that's carried out, and how it has longevity in terms of its results. I'd now like to hand over to Aisling McGrath, who's been the lead researcher on the Sheds for Life evaluation, and Aisling has some more detail on its findings.
Thanks, Linda, for that introduction. So hi everybody, it's great to be with you all today. Kicking off Men's Health Week. I'm really excited to be able to present some of the findings from our Sheds for Life Impact Report. So as Linda said, I'm Aisling McGrath, I'm from WIT, and my principal role is in the evaluation of the Sheds for Life programme. I just want to give a nod to the Irish Research Council for supporting this work, and also to my supervisors, Dr. Noel Richardson and Professor Lee Murphy, who are absolutely instrumental in this as well. So some of you may have heard me talk about the research in the past, where I go into maybe the science behind it, looking at the effectiveness, so the positive benefits it has on the men, and also the implementation. So for anyone who's interested in learning a little bit more about that, I would encourage you to have a look at the impact report, and also our recent study protocol paper that we published in the BMC Public Health. But today I really want to focus on what Sheds for Life is about, how we make Sheds for Life work, and also share some of the experiences from the men themselves, which they were gracious enough to share with me. So all of the quotes that you'll see here today are from the men, so I just encourage you to maybe have a read of those as you follow along with me. So I think at times there is a message out there that men are just unwilling to engage with health. They don't like to talk about their health. They're a little bit difficult to engage in health services. And as a result, they just don't do as well in terms of health as women do. I think, you know, this is so embedded in society that almost it becomes a self-fulfilling prophecy for men. And you can see this in some of the quotes from the Sheds for Life participants themselves. So they think that it's simply not what men do, that the perception out there is that men don't talk. And even more alarming is that they feel like, you know, it can be a failing on them as men. And yes, it can be down to things like feeling like they have to be masculine, that they have to be strong and competitive. But, you know, individuals cannot be held accountable for, I suppose, systemic failures in our society and in our health services that fail to account for things like gender and how they affect our exposure to risk factors, and also how we engage with health. And also, if you are going to be constantly reinforced with the same message throughout your entire life, then, you know, you're going to believe that. We're lucky in Ireland that I think we have a rich landscape, as the Minister said, in terms of our research. We're the first country in the world to have a mental health policy, and also our Healthy Ireland Men, which really aims to understand the way that gender can kind of intersect with economical, environment, social and political determinants of health. And so Sheds for Life really aims to respond to that and understand the way gender impacts health. So why do we bring Sheds for Life to the Men's Sheds? What is it about the Sheds? So Sheds for Life is a community-based men's health programme. It's delivered directly in the Men's Shed setting. The Men's Sheds is a grassroots member-focused space, and in the shed you'll meet men from all walks of life. They have an absolute wealth of knowledge and experience to share. And yes, sometimes there are men in the sheds that may be a little bit more at risk in terms of maybe some disadvantage, or, you know, in terms of illness or loads of other different factors. And so what Sheds for Life likes to do is just try and encourage men like that to engage and have meaningful conversations about health. So I like to think of the Men's Sheds as almost the foundation upon which Sheds for Life is built upon. And why that happens is because there is real natural and organic health promotion happening already in the sheds. So things like, you know, it being male specific, it offering that sense of safety, that sense of purpose, the social support, it's inclusive, it's a non-clinical and it's a pressure-free environment. It is incredibly important, though, that Sheds for Life does actually enrich that environment and it doesn't undermine it. So we work very closely with the Men's Sheds members, or shedders as I'll probably refer to them quite a bit, in terms of allowing them to, I suppose, define what their own needs are and ensuring that we have an appropriate delivery model. Because sometimes when you're trying to bring what could be formal healthcare in an informal space, you know, it could maybe damage the organic health promotion that's actually already happening there. So the solution is that we design Sheds for Life in a way that is gender specific, and also by working very closely with the men. So some of the things that we do: active recruitment. So the association goes out and talks to the men about the programme. It's voluntary, so men express interest in the programme. It's never forced upon them. It's tailored and targeted as well. So men can select different components of the program. They can tailor it to suit their sheds. It's also targeted in a way that's delivered directly in the men's shed setting where the men naturally congregate and where it's also safe and familiar. We work on trust building, so working to build those relationships before we even try and implement anything, you know, so we can really understand one another. Focusing on that informal delivery, Sheds for Life is delivered in a very informal way. It's very conversational and very inclusive. And the association works with allied partner organisations who really do understand the importance of that and respecting that environment. It's a participatory research approach. So what I mean by that is that all the key stakeholders, so the men's shed members themselves, the association, the academics involved, and also the provider organisations are key decision makers in terms of what the programme should look like. And that helps to overcome, you know, implementation barriers, increase the sustainability of the programme, and also just make it more appropriate for the men involved. That gives them a level of autonomy and choice over the programme as well. So they feel like they have control over it and they can really much come and go as they please. We respect that informal environment in the sheds. It's co-designed, so again, men are key to the decision making. They design what they want the structure of the programme to look like, the content to look like, and how it's essentially delivered. We work on engaging leaders and champions too. So there's men in the sheds that really understand the message behind Sheds for Life. They champion the programme, they communicate really important messages. They're also really instrumental, I suppose, in encouraging men that might be a little bit more reluctant or anxious about getting involved. We also use things like hooks. So things that will engage and get buy-in. So things like the free health check works really well. Also removing costs, so breaking down barriers there, making it inclusive for everyone, so that's just not an issue. Really simple things like providing structure and clarity, you know, planning, making sure that they have a clear line of instruction, a clear plan of action, and that they're supported throughout so that they feel like they're invested and supported in. I have to give a massive shout out to Leanne McCree-Murphy, who's instrumental in doing all of that behind the scenes. Strengths-based approach. So really it's important that, I suppose, again, acknowledging that there is a wealth of experience and knowledge in the men themselves, and it's evoking that from them so that they can actually support one another. Everything comes down to this then, the respecting the shed's environment. So really understanding, you know, that we need to work with the men, need to, you know, respect their needs and their wishes, but also really respect the shed. And we adapt the programme to ensure that that happens. So Sheds for Life, you know, probably will evolve over time. As I said, we continually aim to respond to the men's needs. At the moment, it does look like a 10-week programme, begins with a health check. There's weekly physical activity. It's either facilitated by CL Blue, which focuses on strength and mobility, or Get Ireland Walking, which is a walking programme. Healthy eating and cooking skills then facilitated by Healthy Food Made Easy, and a mental health workshop, which really focuses on, I suppose, normalising conversations about mental health in the sheds, and that's facilitated by Mental Health Ireland. There's also the optional components above then with things like oral health awareness, cancer awareness, getting online, which would probably be really important going forward now after COVID, diabetes awareness, suicide prevention, CPR and dementia awareness, which we've recently added too. So when we rolled out the programme in the first phase, we delivered it in 4 counties. So we went to Waterford and Kildare, Louth and Limerick. Across the 22 sheds, we estimated that there was 565 men. And of that, 421 men participated. So that combined with average attendance rates throughout the programme, we estimated that engagement and reach was at 73%, which was a really, really positive, I suppose, finding, considering that it can just be a little bit more challenging to engage men in the health. Just to give you an indication then of the men who participated, what their health might have looked like or their characteristics before they participated in the Sheds for Life. So looking at their health parameters, things like their BMI, their waist circumference, maybe that the majority of them were out of work at the time, their age, that a quarter of them had only completed primary education, majority not meeting the physical activity guidelines, as well as their family history. Some of them may have been a little bit more at risk of illness, so it was an important, I suppose, intervention there. So what happened when we rolled out Sheds for Life? So when it began with the health check, 80% of the men, almost 80%, were referred to their GP, and that would have been because of, you know, something showing up in their health screening, maybe high blood pressure, high cholesterol, and so on. So that really does, I suppose, highlight the importance of having a targeted health intervention like that and the importance of that health check. And you can see from the quote here that it was actually instrumental in saving, or potentially saving lives. At follow-up then, almost 42% of the men who were in that category actually reported visiting their shed or their GP, which was a significant number too. So the days that the men were physically active also significantly increased, and they remained significantly higher 12 months later, as did the days that they spent walking, and their self-efficacy to be active, which is an important indicator for maintaining that behaviour. Many of the sheds also reported continuing their walking groups, their exercise classes themselves after the 10 weeks of Sheds for Life. And we know that physical activity is vital to maintaining and improving our mental, our social and our physical well-being. So it was really encouraging to see significant increases in the number of men that were actually meeting the physical activity guidelines after Sheds for Life. We also know that based on the latest WHO physical activity guidelines, that of course some physical activity is better than none at all. So it was just fantastic to see men getting active in some capacity. After the Sheds for Life programme, there was a significant increase in those reporting that they like to seek information about their health. And this is something that's particularly encouraging for men that might find it a little bit more difficult to engage with health. And also sometimes, you know, where men might avoid or ignore signs of ill health. How we feel about our lives is also subjective and individual to us, but nonetheless, it's a really important indicator for well-being. So it was really positive to see that shedders' self-rated health, how they would have rated their health, significantly improved. Life satisfaction and life worth significantly increased after Sheds for Life and remained higher even a year on too. And life satisfaction was high at baseline, so before Sheds for Life. And I think that that's kind of a positive finding as well, because maybe it highlights, you know, the benefit of simply just being a member of a shed. And we know that social capital and sense of connection is so important for well-being. And we all feel like we need to belong. So it was really positive to be able to see that there was a significant increase in how shedders would have rated their levels of close support, feeling that they could trust others and that they belong to their shed. And you can see from the code here that it really highlighted how it really enriched the shed and that it brought them closer together, you know, and becoming more outgoing about talking together. Shed members participated in Healthy Food Made Easy as part of Sheds for Life as well. And we looked at how they cooked as well as the methods they used, so whether it was using the microwave or cooking from scratch, and both positively changed. We also measured their confidence in areas relating to healthy eating and cooking, so things like getting the groceries, food hygiene, following simple recipes, and all of those significantly improved. Mental well-being scores significantly increased after Sheds for Life and remained higher than before Sheds for Life 1 year later, even for some of the participants who were actually experiencing COVID restrictions at the time. The men who felt comfortable having a conversation about their mental health also significantly increased, as did their understanding. Shedders who participated in safe talks with the suicide prevention training also reported an increased willingness to talk about suicide, which was something that was really positive, and signpost someone in distress. And the men expressed how Sheds for Life really just changed their perception about mental health and also facilitated more meaningful conversations in relation to that. And just in relation to some of the other components, so in terms of digital literacy, shedders felt more certain in connecting online and using online services, which again is going to be something that's going to be really important, I feel, going forward. Results demonstrated significant increased knowledge and awareness about diabetes. They were also significantly more confident in if they had to perform CPR, in terms of their oral health as well, and also recognising early cancer detection signs, knowledge about male-specific cancers and the screening services that would be available. We measured the impact COVID was having on shedders during follow-ups, and I wanted to share some of this as I feel it is valuable in understanding how protective the sheds are for men and how important programs like Sheds for Life will be to engage men going forward. So the graph on the left illustrates two cohorts of men. So the green cohort was before COVID and the red was during. So we measured loneliness before the men joined the shed, so pre-shed, and then before Sheds for Life, so that would have been baseline, and then 3, 6 and 12 months. The group experiencing COVID, so that red line there, was similar to the other in that loneliness dropped when in the shed and remained low. But when the shed closed, you can see loneliness beginning to rise significantly. Shed members that had a score of 6 or over fell into that at-risk lonely category. So the graph on the right illustrates that when the shed was open, those who fell into that lonely category was actually only at 1.4%. But 6 months down the line, then that actually increased to 29.7% and then up to 39.2% 12 months later. So it really does highlight, I suppose, the protective factors that sheds have in terms of protecting those who might be more at risk of isolation or loneliness. In terms of the Sheds for Life initiative, it's demonstrating good value for money, and this is something that's really important. Value for money in the sense that, yeah, it's accessing men that may not be that easily accessed at times. So it's great to be able to do that. But we're also looking at a cost analysis, and the results are really encouraging. We're working on that at the moment, but as it stands, it is showing that the program is actually a cost-effective model. So I just encourage you to read some of the quotes here, and I suppose it's one of the more positive things that have come out of Sheds for Life, that the legacy of Sheds for Life is that it is fundamentally changing the way men talk, and it does so in a way that men don't feel like their masculinity is undermined, that talking is a manly choice. I think in Ireland we're all devils for saying, sure, it's grand, I'm grand when we're going through things in our lives. But actually, it's when you say, no, this is a really hard thing that I'm going through. That's the masculine, manly thing to do. So I'm always blown away when I'm in the sheds and I see that happen. I just think it's fantastic. And I think these approaches are so progressive in advancing gender equality in health as well for both men and women. Because we know from the evidence that when men engage with health, when they talk more openly about their health, and when they lead healthier lives, women and children and other men, and also the boys that are going to follow in the footsteps of these men, can only stand to benefit. So it's a really important thing. We're hopeful that the next phase of Sheds for Life will be implemented in the sheds in September with a further 4 counties, all COVID dependent. Sheds for Life is meeting men where they're at really though, and it's accepting who they are and helping them to understand that they can do health on their terms. The programme is reaching men. It's also engaging men and improving health and well-being. It is a scalable model, so we know that we can give it to every shed in Ireland if they were to want it, because we've rolled it out in different sheds. So there's no reason why it can't be implemented all over Ireland with the right backing and the adoption by the right sectors, and it's good value for money. We know that it's going to be needed more than ever in the wake of COVID-19 to reconnect, particularly for more vulnerable older men. The key message that I'm asking you to take away is that men are willing to talk, they will do it in the right environment, and the way to facilitate meaningful conversations and encourage positive health and well-being in the sheds is using that gendered approach of Sheds for Life that is co-designed, gives men autonomy and control over their health and well-being. So thank you very much.
Thank you very much to Aisling for that extremely informal and comprehensive presentation. I think we're very fortunate to have someone of Aisling's expertise in the area of men's health, and particularly the Sheds for Life project. And I think at this point she's pretty much an international expert on the subject. I think, you know, just looking at the questions coming in there, there's a couple of key issues, I suppose, that people are inquiring about. One being, is there kind of a difference in the finding between the urban and the rural sheds? Another question coming in is around the gender-specific strategies, and people looking for a bit more detail on what that actually means in practice. And again, it's an issue that we can perhaps discuss in further detail in the discussion panel. And I think your finishing point there, Aisling, is very important, which is around the key message that men are actually willing to talk, and the barriers that are there actually do break down, and men do talk face to face in the right sort of an environment. And I think that's hugely important, and one of the, I suppose, key findings really of the Sheds for Life Impact Report. At this point, I'd like to welcome Laura McGaughey, who's the Executive Director of Sláinte Care, and just take the opportunity, I suppose, to thank Sláinte Care for the funding that has allowed this particular project to actually take place. And I'll talk about it a little further later on, but it is, I think, really good to see that, you know, all the government, state agencies and all the government actors that are there coming together to put a project like this together, to do it properly in terms of piloting it, get the proper kind of research done, which has happened and take place. And all of this is then backing up actually government policy. So I think there's a lot to be taken from the actual model in which the Sheds for Life project has worked. So without further ado, I shall hand over to Laura. Thank you.
Thanks very much, Enda, and thank you to you and your team for inviting me to join you this morning to learn about the positive impacts of the Sheds for Life programme. We were really pleased to be involved in it so far with the other partners, as you said, Enda. Aisling's research findings are really interesting and have wider policy implications, I think, for how health and wellbeing programmes are co-designed and delivered in a targeted and specific way. Promoting the health of our population to prevent illness and address health inequalities are key to Launch Care and Healthy Ireland goals. And Sheds for Life is a fantastic example of this happening in reality. And the stories we've just heard from the men who participated in the programme bring this home in a really positive way. As we've heard, the 10-week programme focuses on preventing illness and on empowering men who may be isolated or at risk to become more engaged in their own health and wellbeing in a way that is easily accessible, local and part of the community. And these activities benefit not only the men themselves, but their families and wider communities, while beginning and sustaining positive practices in men's engagement and empowerment around their own health and general well-being. With the challenges many individuals and communities have faced during the COVID-19 pandemic, Sheds for Life has tested and proven that it has a positive effect on combating loneliness and isolation among certain groups of men, as well as enhancing quality of life in a way that is in line with the Launch Care vision. I'd like to say sincere congratulations to the men who took part in the programme. You've invested in your own futures in a really positive way. I'd also like to express my sincere thanks to the Sheds for Life team for your dedication to the project. We really look forward to working with you all on expanding and developing this programme. I think the points Aisling has made in terms of value for money are really important, and the fact that there is a ready vehicle all around the country in the sheds, and men who would be interested in participating in this programme, it talks exactly to the agenda that Launch Care has. We also look forward to taking on board Aisling's research for future programme development, in particular in a way for a programme that we're developing with the HSE called Healthy Communities. Very happy to talk to Men's for Shed and to you and your team about that in a bit more detail. I think your next speaker, Helen Dealey, is also involved in that with us, in that programme with us. So look, thanks again to everybody who took part, and thanks for having me on board today. Really appreciate it.
Sorry, couldn't unmute myself there. Thanks very much for that, Laura, and certainly we do look forward to sitting down with you and going through this in greater detail and see where we can take it in the future. I'd like to introduce you at this point to Helen Dealey, who's the Interim Assistant National Director of Health and Wellbeing and Strategic Planning and Transformation with the HSE. Again, I would just like to take the opportunity to thank the HSE for the funding. The HSE fund the core functions of the Irish Men's Sheds Association, and we work quite closely with Fergal Fox on that, and I do have to compliment them in relation to the real kind of practical approach that's taken, and it is really about ensuring that, you know, public money does have a real impact in terms of health promotion for men, and I just wanted to take the opportunity to thank the HSE for that, and hand over to Helen now. Thank you.
Thanks, Enda, and the best of luck to you in your new role in the Irish Men's Shed Association. I'm very pleased to be speaking to you all on this occasion of the launch of the Sheds for Life Impact Report. The HSE, as Enda has referred, have been working with the Irish Men's Shed Association for a good number of years now through funding the organisation, and we're aware of the wonderful work that they do. Men's Shed provides spaces which offer men a safe and familiar environment in which to foster a sense of purpose through developing new skills, through sharing projects and activities, all of which enhance the health and well-being of men. We knew this setting was already producing well-being outcomes in terms of social connectedness and community involvement, but the Sheds for Life programme takes that to another level in terms of health awareness and health behaviours. The development of the Sheds for Life programme has provided a structure to focus on and engage men in improving their overall health and well-being. Sheds for Life engages men in meaningful discussions about their physical as well as their mental well-being, while encouraging them to be more aware of their health and maintain healthier lifestyles in areas of healthy eating, physical activity and mental well-being. Delivered in local communities, Sheds for Life encourages local connectedness, developing friendships and reducing social isolation. Now more than ever, we value the importance of social connectedness and understand how important it is in supporting our overall well-being, which is one of the key elements of the Sheds for Life programme. Well done to all involved in making a positive impact on the health and well-being of men, on their mental health, on their physical health, and their willingness to engage with their health and well-being overall. This is a very positive contribution to the implementation of both the Healthy Ireland framework and Connecting for Life through the HSE Men's Health Action Plan. This impact report demonstrates the effectiveness of targeted interventions in improving health outcomes and social connectedness for hard-to-reach gender-specific groups. The findings spell out very clearly that we have used a setting, Men's Shed, and developed a programme to be flexible enough so that it's positively received and is effective. The findings are important for us as funders and policymakers in how we reach and support hard-to-reach groups with targeted interventions to improve their health outcomes. We welcome this report and the need for more work to be done in this area. As Laura referred to, we are currently working on the development and rollout of a Sláinte Care Healthy Communities programme, which you'll be hearing more about later in the year. Our Healthy Food Made Easy programme and the further development of social prescribing are two key components of this initiative, and I'm delighted to see that Sheds for Life can work in conjunction with these initiatives. The outcomes on healthy eating and men's engagement in this area is something we found difficult to achieve before. I hope the Sheds for Life everywhere will continue to be a place to which we can refer men in the knowledge that they will get positive social support. Further recommendations in the report are applicable across many other projects and initiatives funded or delivered directly by the HSE, such as programmes should continue to evolve and adapt over time to the needs of their audience. Strengthening and maintaining partnerships is key. Gender-specific health and well-being programmes that target hard-to-reach groups and support people to make a change in what they do, either by looking at what they eat, building in exercise as part of a daily routine, or watching our alcohol intake, are essential. I commend the Men's Shed Association on the wonderful work they do, and I would like to congratulate them on the launch of the Sheds for Life report. In particular, I would like to thank the men who took part in the research, Ashley McGrath and Niamh Murphy from Waterford Institute of Technology, and Noel Richardson, Carlow Institute of Technology, who undertook this important research. In particular, I wish to thank Noel, who has supported the HSE in driving the importance of focusing on men's health for a number of years now. Barry Sheridan and Edel Byrne for their work over the years in this area with the Irish Men's Shed Association, and I wish them the best in their new roles. From the perspective of Healthy Ireland, I would like to commend all the partners for getting behind the Sheds programme and supporting the development and evaluation of the work. So finally, I would like to wish everyone a healthy Men's Health Week, and I look forward to working on the future implementation of the Sheds for Life programme.
Okay, thanks very much for that, Helen. I think one of the most striking statistics from the report was this pre-COVID, 1.4% of men who attended sheds around the country indicated that they were lonely, and in, I suppose, 1 year later, in the middle of COVID, that figure had jumped up to 39.2%. Almost 40% of men were reporting a year later that they felt lonely and that loneliness was an issue for them. And I think your point there about, I suppose, targeting groups and social prescribing and getting to the hard to reach groups is probably never going to be as important as it will be across the coming months and years ahead. At this point, we're going to go to a panel discussion, and we have a number of questions coming in from viewers this morning, which we will go through. So I'd now like to introduce you to our panel of experts who will take questions. First of all, we have Noel Richardson, and Noel is Dr. Noel Richardson, sorry, I should say, from the National Centre for Men's Health in Carlow IT. We have Aisling McGrath, who is the lead researcher from Waterford Institute of Technology, who we've just heard. We have Fergal Fox, who's the General Manager and Head of Stakeholder Engagement with the HSE. And we have Muriel Farrell from Sláinte Care and is a Programme Lead with Sláinte Care. So just going through the questions here. So I'm going to start with people as they appear on my screen. So unfortunately, Noel, that's yourself. I'm just running through some of the questions here. The first one I'm just going to send to yourself, Noel, is one of the viewers is asking, why do you feel that Sheds for Life has been so successful and this particular program has been successful where other programs maybe have struggled?
That's a really positive question to begin, I think, and there are so many reasons, but if I could probably distill it down to three, and I think Aisling's excellent slides have covered some of these points already, so forgive me if I repeat, but I think the methodology used was a critical factor. So Sheds for Life was never about imposing a health agenda on men in sheds. It was always about working in partnership, respecting the autonomy and independence of shed members to decide what they wanted in the sheds and what they didn't want. So that was a really important piece, that co-design element, and the relationships aspect of the methodology. There was a huge investment in developing strong relationships ever before any component of Shed for Life was developed. So building that trust, that safety, that sense of security that men felt confident in the program was really important. The second key point, I think, is that Sheds for Life was always built with sustainability in mind. And I can't emphasize the importance of enough of that interagency partnership development that's so important to ensure that the program will hopefully survive and last over time. And also that allows a kind of a flexible model to be developed. So as men in sheds see the need for new components, the model allows new components to be added over time. And thirdly, then I think, and I would be biased in this regard, but I think Aisling's research is so important in this kind of work, that we build a strong evidence base. And I think that'll be a critical factor in sustaining the program over time and ensuring that it is successful, is establishing what works, what needs to be improved upon, and it gives us a really good roadmap and blueprint for future rollout and scale up of the program.
Very good. Thanks, Noel. Aisling, you're next on my screen, so I'm going to go to yourself with the next question, which is around what advice would you have for people that are thinking of joining a program, and why would they join a program? Some of our viewers this morning, I suppose, have an interest in it, and there's many shedders on the launch this morning who I suppose may not have had the option prior to now to getting involved in a Sheds for Life program because it may not have been in their area as it's been a pilot project. So would you have any advice for people who would have an interest in joining?
Yeah, I'm really glad you asked me that question, actually, Enda, because firstly, I just want to say that it's, the sheds in general are really inclusive spaces. I think that there are men out there that think, oh, the sheds, wouldn't be for me. It's for all the old fellas down in the shed. But I suppose it's important to highlight that it's not. It's such an inclusive space, and there's something for every man to gain out of it. In terms of the Sheds for Life program, I'd say, just give it a try. Go in with an open mind. It's a very light-hearted and experience. It's not meant, as Noel said, to impose anything on men there that participate. You contribute as much or as little as you like. No one's going to come and tell you what to do. You have full autonomy over your choices that you make. If it doesn't suit you to participate some of the time as well, that's fine. So it's very informal that way. No one's going to come and chase you down or hold you accountable for that, What I will say that it is a great experience. It's fun, and you're in the company of like-minded men. There's the banter and the crack there as well, which I think is just really, really nice to witness that. And no one takes themselves too seriously in Sheds for Life as well. So, you don't feel like you have to, unload all your deep dark secrets or anything like that. So the best learning though I think really happens is when we push ourselves out of our comfort zone. But what's really great about Sheds for Life is you do that in the comfort of the shed with your friends. So there's loads of social support there as well. So I think, you know, just give it a go. And also by participating in Sheds for Life, you know, the men that do that are almost pioneers because they get to share their views and they have a voice in determining what men's health should look like, what Sheds for Life should look like, you know, and how we should respond to that. So that's really important.
Very good. Thank you for that. Fergal, you're next up. In relation to organisations, I suppose, Fergal, they're looking in this morning and they're sending through some questions about, you know, what advice you'd have for them, what organisations would need to do to get involved in this as a partner, I suppose.
Well, first of all, I suppose we should credit the numerous partners that have been involved in this, in the rollout of the pilots so far. Like, I know some of the, you know, the individuals working for these organisations like Mental Health Ireland and Diabetes Ireland and the Dental Health Foundation, and there's several organisations there. But these, you know, the staff involved have shown a real commitment to figuring this out together through the Sheds for Life advisory group. And I think they deserve a lot of credit. They've shown a huge commitment and diligence to men's health. So credit is due in spades to them for their flexible approach. In terms of other organisations looking in, I suppose what we have learned, and well, we knew this beforehand. You know, I was thinking of some of the speakers earlier on. I recall Colin Fowler making a joke out of it years ago from the Men's Health Forum, saying, you know, that we always say we should meet men where they're at in terms of health promotion. You know, good you know, common sense and evidence-based approach to community health promotion. But we didn't always do that. But the Sheds for Life and the Irish, you know, the men's sheds generally is using a setting and actually meeting the men where they're at. I know that's a phrase that Aisling used in her presentation, but it's very literal in this sense for the Sheds for Life. So I suppose in other organisations, you know, what we've learned about engaging men is trying to understand where they're at and meet them at that level. And the Sheds for Life is just, I suppose, the ultimate key setting where we can do that in a very practical sense and a very pragmatic way. So I think that's one of the key points of the organisations. You know, credit to those myriad of organisations that have been involved to date, and encourage any other organisation to support our work or support the work around men's health and wellbeing. And I think this week, Men's Health Week, is a great opportunity for that. We have a webinar ourselves going on Wednesday around the how of men's health, which is all about how to engage men's health. And there's lessons from the Sheds and there's lessons from other settings. You know, we launched the Men on the Move program, another community-based health promotion initiative last year, or it was 2019 actually. You know, it's mainly run by the local sports partnerships. But like, that's another example where we're trying to use the best practice and the evidence in relation to engaging men and utilize it at a community level. And really, it's transformative, and that's where the feedback is coming from. You know, that the men overwhelmingly, you know, they're really taken aback by how such a simple approach in some ways of what it appears to them. I know there's a lot of beavering going on in the background and a lot of development in the background. It's not, but like it's very simple and pragmatic in its delivery. So I think that's what we've learned, and we're trying to bring all our learning around men's health out to a broader audience. So we're doing that through Wednesday's webinar and I suppose in Men's Health Week generally. So I suppose I'd encourage organisations to get involved in Men's Health Week, and I know a lot of people are already, so I appreciate their support on that.
Very good, Fergal, thanks very much for that. Muriel, last but not least, where do you see, I suppose, the Sheds for Life project fitting into the kind of overall new strategic plan that Sláintecare itself has?
Thanks, Linda, and congratulations on your job. Yes, Laura and Fergal and others have mentioned these throughout their pieces. So the Men's Sheds programme reflects many of the key Sláintecare priorities. For example, it promotes health and wellbeing and addresses health inequalities. And these are key reform priorities in the Sláintecare Action Plan, Healthy Ireland strategic plan. Men's Sheds, it's a tailored, we've heard this morning, it's a tailored gendered response. So it's providing men with access to information and services in a safe and familiar environment. And this aligns very much to the Launch Care priority to put citizens at the core of service planning and to provide the right care or the right programme in the right place at the right time. It is a community-based programme, which is really important for Launch Care. And the key partners and participants are working collaboratively and empowering the participants in the care of their own health. It has a strong focus on measurable outcomes, which is demonstrated by the evaluation this morning and the many publications. And it provides great learning opportunity, not only for how to promote other health promotion strategies, but also innovative ways of meeting citizens' needs. So all of these elements are key to implementing Launch Care. So again, well done to all.
Very good, thank you, Muriel, for that. I suppose just a final kind of question or two that I'll just maybe throw open to the panel. I suppose, which is around what do Sheds for Life kind of look like in the future, and what kind of are the biggest challenges that you guys feel that will be facing it?
Well, if I can kick it off there, I suppose the challenge is always about you know, upscale and fidelity, and there's a flexibility to this program, which I suppose is a strength, you know, but that'll be a challenge as well to maintain certain elements of the program while having a flexible nature. I think that the challenge, which again is any challenge is an opportunity, but coming out of COVID has been referenced a couple of times. Like COVID showed Aisling and the report how much Sheds for Life is needed. You know, the stats that have been cited around loneliness. So, you know, that is a challenge that, you know, that there's a lot of our communities and people in our communities feeling, you know, punch drunk at the moment from COVID, and we need a huge, you know, focus on our well-being for the next couple of years to pull ourselves back up and show and be resilient to the experience of the last 18 months. And Sheds for Life, that's a massive opportunity for us. You know, there's way more people interested and engaged in their health and well-being now. And I suppose we want to utilize that interest, and I think that's a great opportunity for us.
I'd agree with Fergal as well on those points. Just add one additional point. I think it's the fact that the evaluation report is published today shouldn't be seen as the end of the line in terms of research and evaluation. We really need to be mindful as the program hopefully grows and develops over time of continuing to have the shedders' voices as a central part of refining and continuing to develop and grow the program over time. So that kind of continuation of evaluation research should continue to underpin the program. That's also a challenge, I think.
Yeah, and just to echo Noel's points there as well, that I think, you know, if we're going to roll this out nationally, or it's going to, you know, scale up, which hopefully it will, because it, you know, it absolutely should, that we don't lose sight of, you know, the underlying, the essence of what it's all about, and respecting the Sheds environment and not making it formal, and always, you know, including the men in all the decision making that happens, because, you know, that's how it works. And I think it's just going to be really important going forward that we remember that and we don't lose sight of that.
Yeah, very good. I think some very interesting and useful points there. I think in relation to scaling it up, as Fergal has said, I think it's very important that it doesn't lose the real qualities that it has in terms of its informalness, so to speak, in one sense, and yet it has delivered from certainly the evaluation report's point of view, it has delivered across a huge range of key kind of components that one would be looking for it to actually deliver for men in a practical sense. And obviously a key point being that as things stand at the moment, they're sustainable within an individual's life. So it's not just like someone turns up for a program or a course and then 3 or 4 weeks later it's forgotten about. You know, the results of that are sustainable within people's lives, and that has to be hugely significant within it. I think from the Irish Men's Sheds Association's point of view, we will obviously be sitting down to speak with all the key actors at state level over the next couple of weeks and see you know, what are the options around scaling this up, because I think it is something that we do need to have available to men right around the country. We have around 10,000 men per week, pre-COVID that is, turning up at men's sheds. And each one of those guys needs to be given that option. And I think as well, one of the other challenges would be to ensure that we can, I suppose, increase the kind of scope of the Sheds for Life in relation to the age group and try and present it to a bigger cohort age-wise. And I think there's lots of challenges around that as well that need other interventions outside of the Sheds for Life programme. I suppose we have overshot our time quite significantly. It just remains for me, I suppose, at this point, just to thank all our speakers this morning, to thank our key funders again, which is the HSE, Sláintecare and the Irish Research Council. We always thank all our I suppose, primary health contributors to the programme. I think there are some secondary health contributors as well right around the country, such as all lots of the county councils to be involved with us, lots of the sports partnerships, the local partnerships, the local companies, development companies that we got, the leader programs, the Men's Development Network down in Waterford, you know, lots of other organizations that help us out all the time. So just a big thank you to all of them. And I suppose just to recircle again on the fact that this is Men's Health Week, and I would, you know, encourage people to get involved in that and go online and find out where the programs are and get involved. I think it is a really worthwhile exercise to be involved in. I just want to thank all the team internally here, Aisling again, Frank and Leanne, who are in the background here, but you can't see them and they're making all the things happen. So thanks very much for all of that. And a big, you know, thank you as well to Carlo and Waterford Institute of Technology, and to Noel and to Professor Niamh Murphy as well. So a big thank you to everybody. We will send out the link to the report to everyone who's online with us this morning. And it just remains for me again just to thank everybody and stay safe, and hopefully we'll see you across the remainder of this week. Thank you.
Thank you.
The Irish Men's Shed Association started an initiative called Sheds for Life back in 2017. It's a dedicated men's health and wellbeing initiative that covers aspects of physical, mental and social wellbeing. We collaboratively work with the men to find out what their needs are, what their interests are, and what way they find is the best way to approach men's health in the men's shed setting. We piloted various different components of programmes with leading healthcare organisations in Ireland, and now we've collaboratively put them all together in this informal 10-week programme.
The Shed for Life. I find this great because it helps focuses my mind, and it's great to get out. I prefer to walk with people rather than my own. Same bunch of lads nearly every week, and as I say, the crack is 90. Again, that's what it's all about, you know. The cooking classes are brilliant as well. The lady who comes here, she's brilliant. She's very interesting. She makes the whole cooking thing quite simple, quite easy. To have these facilities and people come in and talk to us and help us along with this kind of thing. Again, it's another wonderful thing. It's mighty, you know.
Sheds for Life programme I think is brilliant. Coming from a paramedic background, I believe in what they're doing. The food programme and the walking is very good. The computer course is excellent. I would be very technically illiterate, but I've come on in the few weeks that we're doing it, learned lots. The whole thing of the shed is fantastic. In just the year that we're here, you can actually see the benefits, both mentally and physically. Guys are different, there's spring in their step going, and anyone that in a bit of maybe social isolation, just fantastic.
It's a weekly thing. On a Tuesday we go and we train, do a little bit of soft training, you know, for our age we don't do anything too hard. But yeah, it's great, and it's great for the camaraderie that brings us closer again. You know, you limber up and then you do a little bit of like light weights, but look, everything works. And again, you're together with a bunch of lads, and it's great for it's a tonic. Through the men's shed, it's just crack, and just lifts you up out of you know, if you're feeling down, you go up there for the half an hour and the next thing you're in top form. If men can talk about their problems, their mental health, just to unload what's on your head, and that's the men's shed. You can go in and you can unload because the men will listen to you, and I think that's just fantastic.
I think it's brilliant. Topped by today, I have to say. The way Jenny of the Diabetes Ireland conducted it was amazing, that she sat among us. It wasn't a she and us type scenario. We were all there as a group. She listened to everybody and she explained everything in a phenomenal fashion. We share everything. Let it be good, bad or indifferent. It's shared, and as you probably well know, life teaches you that a problem shared is a problem halved. Everybody's equally important, shall we say, here, and we all treat one another with respect. So yeah, I became a member, and ever since that, on a daily basis, you feel better and better and better about myself and participation. And rather than being a single individual sitting up at home feeling sorry for myself, I'm now part of something that's wonderful.
What we're hoping to learn from Sheds for Life is really what works best for the men in the sheds. All of these men are here ready and willing to actually take part in the programme, and again, they designed the programme so it's what they want it to be, and when they take ownership they realise, yes, we can actually engage with health.
The impact we want to see through Sheds for Life is giving the men an opportunity to engage in health on their terms and in that informal setting of the shed. Outreach and finding a way to deliver a programme on the men's own terms and where they feel most comfortable is really, really key to Sheds for Life. We're proving that men can do health, it's just the approach that you take is so important.